Okay, so to say that something is at large is to say kind of that it's out there. So when they say that there's an impact on carers, that is people who are closely interacting with sufferers, family, that is people who are related to and also interact with sufferers, and society at large, that is society out there, they're kind of broader context. So it has a greater reach, the effects of this disease. Um, yeah, can be all of these things.
So
Um,
at large means
at large means something like contextually
mm,
or more generally,
mm,
society more generally.
more generally.
Um,
Okay.
yeah. Um, beyond these immediate um, people that we've mentioned, there's society at large, beyond this closer situation.
Exactly.
Yeah. So we usually use dementia as a label for things that happen to older people. So their memory fails.
Alzheimer disease.
Yeah, so Alzheimer's could be one of the diseases that's connected to dementia. Cognitive abilities, they can't think as quickly or as accurately. They might start to behave in unusual ways, partly related to what they're thinking and what they're able to remember or not remember. Um, So actually there's some physical behavior as well. Sometimes people, if there's effects of these sorts of diseases on the mind or on the brain, people carry themselves in a different way. They can't walk as well. And it's not necessarily a physical cause directly. It's more usually it's about the brain and the Okay, so stigmatization is a stigma is like a mark that you carry that people people don't like it. They want to get away from it. So if something is stigmatized, it's something that people sort of try and keep their distance from. They're like, oh no, I don't want to be near that. So there's a stigma attached to dementia. That is, people are, once they see that someone is demented or has dementia, um, they might they might have a number of different negative reactions. And they won't just be thinking about the specific thing that someone's done, but about that person as a whole as being in that category. Uh, so
So
you're imagining that they're kind of bearing a shameful mark, something that makes them less of a full person or less desirable to interact with.
So, for example, if someone has a lot of tattoos on his face, on all of his body, like a gangster, so can we say that that has a stigma?
Yes, it has a stigma attached
Mm,
to it, definitely.
mm,
There's a social stigma with
mm.
tattooing. Um, and some people who are enthusiastic about tattooing and body modification have, they'll be very aware of that stigma, and sometimes that's a reason why they enjoy it because they want to mark themselves as different from other people.
Mm.
Um, yeah, which is also why I think gang members do it. They mark themselves as part of a criminal group outside of society. Um, yeah, often there is a stigma associated with mental illness. Yeah. So a stigma is something that you carry that other people imagine belongs to you. It's like it's like someone becomes a uh I'm
HIV.
not gonna say so, yeah, so HIV would be an example. There's a strong stigma around HIV. There's stigmatization. That is, people talk about that disease in a way um that has many more negative associations than just the effects of the disease. Especially now, HIV can be very easily managed and treated. Um, at least in places where access to the right drugs is available, but it's still seen as a kind of a stigma that people carry, something that very negative. Um, so the first clause here, there is often a lack of awareness and understanding. So because there isn't good knowledge about dementia, resulting in barriers to diagnosis. So because we don't know much about it, it stops us from diagnosing it well. People think that this is just a natural, if horrifying, part of getting older. So they don't seek out medical care. They don't seek out advice from professionals. They don't look at ways to manage the condition. Um, they don't look at the best ways to treat people who are developing dementia.
Adam,
Yeah.
one question I forgot to ask here. In the group, it is asked why we cannot use here tag significantly with a person's ability.
Because it's having a negative effect on their ability. So if you tag something, you're kind of attaching a label or a tag or
Mm.
something to them. But in this case, what's happening is that they're able to do things before and then they develop dementia, and that condition interferes with that. They can no longer do those things. They're no longer able to in the same way. It doesn't stop them entirely, but it interferes. Um,
So,
that's right. Yeah. It partially prevents them from being able to do ordinary things. Partially prevents them. And in this case, it interferes significantly. So it might be quite close to preventing them. They might no longer be able to do things that they could ordinarily do.
so I should be careful when I get old. Nothing should interfere with my ability. Okay.
If any of your family or friends notice signs of dementia, you should look for diagnosis. Go
No,
to a medical professional and see if they can advise you on what the problem is.
they don't
Some
have diseases. They don't have money. That's the
there
problem.
there are some conditions that are associated with dementia that are actually treatable,
Mm.
as well. So this is why it's important not to just assume that old
Mm.
people get dementia.
So you mean
Because
that some young
sometimes,
people might get that?
oh, it's not just that, it's that when old people start to show signs of things that might be seen as dementia, um, it could be one disease or it could be another. Like some diseases are treatable, other diseases aren't.
Mm.
So it's worth finding out if you can whether you're actually sick with something that's treatable or not.